Is there a connection between masturbation and prostate health? As you age, understanding how your body functions becomes even more important, especially when it comes to sensitive topics like sexual health. The prostate gland plays a crucial role in male reproductive health, and its function can be affected by various factors, including sexual activity. Research suggests that regular ejaculation may have significant implications for prostate health, particularly as men get older. Let's explore what actually happens to the prostate during masturbation and why frequency matters. When a man masturbates, the prostate gland becomes actively involved in the process. This walnut-sized gland sits below the bladder and surrounds the urethra. During sexual arousal, the prostate begins to swell slightly with increased blood flow. As arousal builds toward ejaculation, the prostate contracts rhythmically, releasing prostatic fluid that makes up about 30% of semen. This fluid contains important nutrients and enzymes that protect and nourish sperm cells. The physical act of these contractions serves an important purpose beyond pleasure. Each time the prostate contracts during ejaculation, it essentially performs a self-cleaning function. The forceful contractions help flush out the prostatic ducts, clearing accumulated fluids that might otherwise stagnate. This natural cleansing process may help prevent the buildup of potential irritants or substances that could lead to inflammation or infection. Scientific studies have examined the relationship between ejaculation frequency and prostate health. Several large-scale research projects have found that men who ejaculate more frequently, around 21 times per month or roughly 3 times per week, may have a lower risk of developing prostate problems later in life compared to those who ejaculate less often. This protective effect appears to be particularly significant for older men. The reason behind this potential benefit relates to the prostatic stasis theory. When a man goes long periods without ejaculating, fluids in the prostate can become stagnant. These stagnant secretions might contain substances that could irritate the prostate tissue or potentially become breeding grounds for bacteria. Regular ejaculation helps to clear these fluids, keeping the prostate in better working condition. Additionally, regular ejaculation might help reduce stress on the prostate gland. The release of sexual tension through orgasm can relax the pelvic muscles, potentially improving blood flow to the area and reducing pressure on the prostate. This improved circulation may contribute to better overall prostate function and reduced inflammation. Some men worry that masturbating too often might harm their prostate, but what does science actually tell us? The truth is that regular ejaculation appears to offer several benefits for prostate health. When semen is released during ejaculation, the prostate effectively flushes out potentially harmful substances that may build up over time. These substances include various chemicals that the body naturally produces, but that might become problematic if they remain in the prostate for too long. Research published in medical journals suggests that men who ejaculate more frequently have fewer prostate health issues. A long-term study that followed almost 32,000 men for 18 years found that those who ejaculated 21 or more times per month had a 33% lower risk of developing prostate cancer compared to those who ejaculated 4 to 7 times per month. This finding held true, even after researchers took into account other factors like diet, exercise habits, and family history. How exactly does this work? The prostate contains tiny ducts that can trap bacteria and other harmful substances. During ejaculation, these ducts contract forcefully, helping to push out these trapped materials. Think of it as a natural cleaning system for the prostate. Without regular ejaculation, these substances might stay in the prostate longer, potentially causing irritation or inflammation over time. Beyond the physical cleaning effect, ejaculation may also help balance hormone levels that affect prostate health. The act of ejaculation triggers the release of certain hormones that can help regulate the prostate's environment. This hormonal balance is important because some hormones, if present in high amounts for long periods, might encourage abnormal cell growth in the prostate. Another benefit of regular ejaculation is improved blood flow to the pelvic region. Good blood circulation helps deliver oxygen and nutrients to the prostate while removing waste products. This increased blood flow might help keep prostate tissue healthy and functioning properly. Have you ever noticed that sitting for long periods makes you feel stiff? The same principle applies to the prostate. Movement and activity generally promote better health. It's worth noting that masturbation is just one way to achieve ejaculation. The potential health benefits appear to be linked to ejaculation itself, regardless of whether it occurs through masturbation, sexual intercourse with a partner, or even during sleep, wet dreams. The key factor seems to be the frequency of ejaculation rather than the method. For men who have already experienced some prostate issues, gentle and regular sexual activity might help reduce symptoms in some cases. The improved blood flow and regular flushing of the prostate can sometimes ease mild discomfort or feelings of pressure in the pelvic area. Despite the health benefits, there are many myths about masturbation and prostate health that cause unnecessary worry. Let's clear up some of these misunderstandings with facts. First, masturbation does not cause erectile problems or make it harder to have an erection. In fact, regular sexual activity of any kind might actually help maintain good erectile function by keeping blood vessels healthy and flexible. Another common myth is that masturbation decreases testosterone levels. Research shows this is not true. While there may be very small temporary changes in hormone levels right after ejaculation, these quickly return to normal. Regular masturbation does not lower testosterone levels in any meaningful way. Some men even report feeling more energetic and focused after ejaculation due to the release of feel-good hormones. Many older men worry that masturbation might make existing prostate problems worse. For most prostate conditions, this fear is unfounded. In cases of prostatitis, inflammation of the prostate, some doctors actually recommend regular ejaculation as part of the treatment plan. The gentle muscle contractions and increased blood flow can help reduce swelling and discomfort for many men. There's also a persistent myth that frequent masturbation increases the risk of prostate cancer. The opposite appears to be true based on large research studies. As mentioned earlier, more frequent ejaculation is linked to lower rates of prostate cancer, not higher ones. This relationship has been found in multiple studies with thousands of participants. Some people believe that masturbation can lead to a permanent enlargement of the prostate. This is not accurate. The prostate does temporarily swell slightly during sexual arousal, but it returns to its normal size afterward. Benign prostatic hyperplasia, BPH, the common enlargement of the prostate that many men experience with age, is caused by hormonal changes and aging, not by sexual activity or masturbation habits. Leave a comment below with your experience on this matter. Your story could help another man going through the same situation. Another misconception is that masturbation might deplete the body of important nutrients. The amount of nutrients in semen is very small compared to what the body uses for other functions. The body easily replaces these nutrients, and regular ejaculation does not cause any nutritional deficiencies. Some men worry that masturbating more than 3 times a week is excessive or unhealthy. For most men, this frequency is perfectly fine and may even be beneficial for prostate health. What's considered normal varies greatly from person to person based on age, health status, and personal preference. Have you ever wondered what doctors actually consider a healthy frequency? The truth is, there is no single right number that applies to everyone. Lastly, some believe that stopping masturbation altogether will improve prostate health. While moderation is always reasonable, completely avoiding ejaculation does not appear to offer any health advantages and might actually prevent some of the natural flushing benefits that ejaculation provides. While masturbation offers many potential benefits for prostate health, there are certain situations where men should be careful or seek medical advice. Not all prostate conditions respond the same way to sexual activity, and what helps one man might not help another. For men with certain types of prostatitis, especially acute bacterial prostatitis, ejaculation might temporarily increase discomfort. This type of prostatitis involves an infection that causes severe inflammation, and the forceful contractions during ejaculation could cause pain. If you have been diagnosed with this condition, it's better to wait until the acute infection clears before resuming regular sexual activity. Some men with chronic pelvic pain syndrome may find that ejaculation either helps or worsens their symptoms. This condition varies greatly from person to person. Some men report that ejaculation provides relief from pressure and discomfort, while others find it makes their symptoms temporarily worse. It's important to pay attention to how your body responds and adjust accordingly. Men who have recently undergone prostate surgery should follow their doctor's advice about when it's safe to resume sexual activity, including masturbation. Most prostate procedures require a healing period during which ejaculation could potentially cause bleeding or interfere with recovery. This waiting period typically ranges from a few weeks to a couple of months, depending on the type of surgery. If masturbation causes pain, burning during urination, or blood in the urine or semen, these are signs that something isn't right. These symptoms might indicate an underlying condition that needs medical attention. Don't assume these symptoms will go away on their own. They could be signs of infection, inflammation, or other health issues. For men taking certain medications for prostate conditions, the effects of masturbation might be different. Some drugs used to treat an enlarged prostate can affect ejaculation or cause other sexual side effects. If you notice changes after starting a new medication, this could be related to the drug rather than to masturbation itself. Men with heart conditions should be aware that sexual activity, including masturbation, causes a temporary increase in heart rate and blood pressure. For most men, this increase isn't dangerous, but those with severe heart disease or recent heart problems should talk to their doctor about any precautions they should take. When dealing with urinary tract symptoms, some men find that masturbation temporarily worsens problems like frequency or urgency. This is usually temporary, but if these symptoms persist for more than a day after ejaculation, it might indicate that the prostate is particularly sensitive or inflamed. Have you ever wondered if there's such a thing as too much masturbation? For most men, the prostate can handle regular activity without problems. However, very frequent masturbation, multiple times per day, every day, might lead to temporary soreness or sensitivity in the prostate region. If this happens, simply reducing frequency for a few days usually allows recovery. For most men, masturbation in moderation can be part of a healthy lifestyle that supports prostate health. The key word here is balance. Regular ejaculation, whether through masturbation or with a partner, appears to help keep the prostate in good working order by flushing out the ducts and promoting healthy blood flow to the area. Research suggests that ejaculating around 21 times per month or about 3 times per week might provide the most benefit for prostate health. However, this number isn't a strict rule. Each man's body is different, and what feels right can vary from person to person. The goal is to find a natural rhythm that feels good and doesn't cause discomfort. Beyond masturbation, there are other steps men can take to support prostate health. Staying well hydrated helps the body flush out toxins and keeps all systems running smoothly. Aim for about 8 glasses of water each day and consider reducing intake of alcohol and caffeine, which can irritate the prostate and bladder in some men. Physical activity also plays an important role in prostate health. Regular exercise improves blood flow throughout the body, including to the prostate. Even gentle activities like walking for 30 minutes several times a week can make a difference. Exercise also helps maintain a healthy weight, which is linked to better prostate health. Diet choices matter too. Foods rich in antioxidants, such as tomatoes, berries, and green vegetables, may help protect prostate cells from damage. Some studies suggest that eating more plant-based foods and fewer processed foods can support overall prostate health. Foods containing zinc, like pumpkin seeds and certain seafood, may be particularly helpful since the prostate contains high levels of this mineral. Regular checkups become increasingly important as men age. After age 50 or earlier for those with family history of prostate issues, talking openly with a doctor about prostate health is valuable. Many prostate problems can be easily managed if caught early. Don't let embarrassment prevent these important conversations. For men experiencing any unusual symptoms related to urination, ejaculation, or pelvic discomfort, seeking medical advice is always the right choice. These symptoms might include difficulty starting or stopping urination, a weak urine stream, the need to urinate frequently, pain during ejaculation, or persistent discomfort in the lower abdomen or pelvic area. Remember that prostate health is just one aspect of overall well-being. Managing stress, getting enough sleep, and maintaining social connections all contribute to better health as men age. Masturbation can be part of a healthy lifestyle, but it works best alongside these other positive habits. Taking care of the whole body helps ensure that all parts, including the prostate, function at their best. Now, if this video helped you understand your health better, subscribe now for more insights every day. Thank you for watching.